What's the weirdest thing a medical professional has casually said to you? I live in Ireland. The surgeon who replaced my hip is also a farmer. The day before I was due to be discharged, he came in on his rounds and said, "I may or may not see you tomorrow, it depends on the dog." So, I asked, "Okay, what's up with the dog?" He told me the dog broke his leg and was having it set tomorrow, but he wasn't sure what time. So, I said, "Sure, bring in the old dog, and I'll mind him." This is rural Ireland, bear in mind, and I was in the convalescent area of the hospital by then. Shortly after breakfast, he arrived with the dog, a lovely border collie with his leg in plaster. He stayed with me, watching TV, until the doctor was finished replacing another hip and was ready to discharge me so we could all go home. It could only happen in Ireland. When I was 12, I had a dentist say, "Hold on, I think I might be counting wrong. You shouldn't have those yet." Okay, never mind, those are definitely your wisdom teeth. Your mouth is just huge, I guess. They said it was the youngest they've ever seen anyone get their wisdom teeth. They called in every dentist in the building to come look at my mouth. A nurse of some kind took my blood pressure. He stated what the numbers were. I asked, "Is that good?" He replied, "I'm not qualified to give you a professional opinion on the matter. You should ask your doctor." I inquired, "But, unofficially, is that good?" He said, "Unofficially, well, in my purely personal opinion, which I'm sharing with you as an individual and not in any medical or official capacity whatsoever, you should buy stronger deodorant." I was getting my blood drawn for a mono test back around 2006. The older lady nurse asked me what sort of music I liked. I figured she was making small talk to get my mind off the needles, so I rattled off a few bands I'd been listening to. One of them happens to be Postal Service. She says, "Oh, I know that one." I reply, "Yeah, it's the same lead singer as Death Cab for Cutie." She says, "I know. He's my son." When my girlfriend was in the ICU, one of the nurses sort of shrugged and said dismissively, "She's gonna die anyhow." She should have. Her kidneys had completely shut down, and she was so swollen that her tongue wouldn't fit in her mouth. We were making the decision whether to continue life support or not. She didn't die. A month and a half later, she walked out of the hospital and into my car for the ride home. I snapped both of my Achilles while finishing off a set of heavy leg presses with calf extensions. I didn't close it all the way, and the sled crashed down on me, pinning my legs next to my head. Yes, I was dumb not to use the safety pins. They weren't there. They constantly disappeared to other machines, so I was lazy for not using them and paid the price. The doctor looked at my scans and said, "These are mirror images of each other. You must have good form." My gynecologist, while trying to remove my IUD when the strings weren't visible and fishing through my cervix with local anesthesia, thank God. "Come here, kitty kitty." In all honesty, I think he spaced out and was very concentrated to avoid unnecessary pain. My uterus wasn't happy with the invasion, and he most definitely has cats, and the words just came out. He burst out laughing with embarrassment and said sorry more times than I could care to count. Honestly, I thought it was hilarious. I've been seeing him for a long time for many IUDs, and he's a gem. I was 18 at the time and went to the family doctor who brought me into the world. The reason was I was experiencing great pain while urinating and was leaking a pus-like substance. After getting a shot, I went to his office. I sat down, and he lit a Winston, rocked back in his chair while taking a big drag, and said, "I am going to talk to you like a Dutch uncle. If you do not know if it is clean, keep your goddamned zipper zipped up." Not said directly to me, and not quite weird exactly, but unique. I was getting a trigger point injection for a pinched nerve. My pain tolerance is extraordinarily high. Historically, when my pain is at a level of 8+, and I say so truthfully, doctors don't believe me. This doctor, however, had an interesting perspective. He had a resident with him that day. He actually had the resident do the injection, which was a little nerve-wracking because of the risk of a punctured lung, but that's beside the point. He told the resident, "So I know you've been taught how to tell when people are in pain. Watch this patient's face while you do the injection." I didn't wince at all, as the doctor clearly expected, and he said to the resident, most patients will show when they're in pain. These injections are extremely painful, and this patient didn't react. Always remember, not everybody reacts to pain in a normal way. As someone who's been dismissed as a drug seeker and a malingerer many times for that exact reason, it was extremely refreshing to hear a doctor not only mention that but actually explicitly teach it to a resident. I'm a guardian for my older brother who is mentally 2 to 4 years old. He had a seizure, and I met him and his caregiver in the hospital. No one could figure out what happened that had him refusing to walk after his seizure. Multiple EMTs, nurses, and doctors had seen him by the time I arrived without anything planned or pain meds given. I asked for details of what occurred during the seizure from his aide and was told he fell on his side. I was like, oh, okay, is there any bruising on his leg? No, not really, was the response. I asked my bro if I could look at his leg, and he was hesitant, but finally let me. Sure enough, there's this tiny little bruise on his hip toward the head of his femur. I put 2 and 2 together and asked the doctor about getting X-rays. He begrudgingly agreed. We get back from X-rays and come to find out he broke the head of his femur completely through. Fucking terrible. This kid was in pain for 24 hours before anyone told me about what had happened. No pain meds at all. My bro is pale AF, hardly responding to things he enjoys, and has a bead of sweat on his brow. Here comes the most asinine response that caused me to lose my shit on the doctor. I said to him that now it's confirmed the issue is a broken bone, can we get my brother some pain meds? The doc says, do you think he needs it? My response was along the lines of, gee doc, how do you think you would feel if you broke your femur in half? Do you not normally administer pain meds for patients in similar situations? I stared at him with utter irritation plastered on my face. He confidently said, well, yes, but he seems fine. Wow, he seems fine. The fuck he does. I've already told you he does not act like this normally. He doesn't randomly sweat, guard his body, or look so pale. If he wasn't in pain, he'd be running circles around us. Just because he can't verbally express his pain doesn't make him impervious to pain. He is clearly exhibiting non-verbal cues of pain. Yes, he needs pain meds. I'm so grateful that I have legal guardianship of my brother. I cannot imagine how others get through our healthcare system without an advocate. Sadly, this experience wasn't our first or last time dealing with something like this. I was in the hospital for a few months last year. I got to know one of the nurses pretty well. She pretty much told me that during COVID, they had to scam insurance companies. She worked on the internal healthcare ward, specifically for lung problems, so the ward was pretty much full with COVID patients, and everything else was pushed back. After a few months, they noticed how all those appointments that were pushed back all became cancer patients. So they pretty much all worked together to get patients their appointments anyway. Apparently, a lot of people quit because they couldn't deal with telling someone there was no room for them in the hospital, only for them to then tell the same people that if they had found the cancer sooner, they stood a chance. Well, if you want to lose weight, you should cut down to 800 calories a day and work out 30 minutes 5 times a week. I was breastfeeding, and this jerk tried to give me an even bigger eating disorder than the one I was teetering on the brink of. You sure you want to be put under to remove the lipoma? It will take longer to put you under than to get it out. Okay, you probably would have passed out anyway. People usually do when we cut on them so close to their vital organs. He did a good job, but I regret going back to him for another surgery because it didn't go smoothly the second time around. When I burn this ward off, it's going to smell like hot dogs. He was right. I was 16 and asked my mom if we could get an extra long chili cheese coney when we were done. She was totally disgusted, but I got one. Oh, there were plenty when my mom was dying in the hospital. First, when she went to a randomer on vacation and the radiologist waltzed in and told her, looks like you've got stage 4 lung cancer. Excuse me a moment, and then walked right out of the room without another word. 3 weeks later when she was dying in another and we were still trying to figure out where the cancer even came from, the oncologist rolled up to my sister, drive, pepper in hand, and told her, you know there's no hope for her, right? The fucking asshole was lucky I wasn't in the room at the time. The whole thing was just a really eye-opening look into the huge lack of compassion in the medical industry. For those wondering, after she died, we had an autopsy done, anaplastic thyroid cancer. Rare and extremely aggressive. I was out of town and was told I needed to get a physical ASAP for something, so I looked up a local walk-in clinic where I was at. During the physical, the doctor asked if I had any medical concerns, and I told him I'd like to lose some weight. He then recommended that I not eat for a week, and that I do this once or twice per month. He then explained that obesity rates in the Muslim communities are very low because of fasting, and then talked for 10 minutes about the Muslim religion and why I should join it. Not only is telling a random patient you just met a few minutes ago to simply not eat for an entire week kinda bad medical advice, but the religious conversion speech was really strange. Thanks for watching the video. Don't forget to like and subscribe to our channel so you don't miss out on the best Reddit stories.